Right now in this country, we have 51 million people without insurance. That is a moral outrage to us. And you heard it said that we need to think about our heart. Well, all those 51 million people are someone's daughter or son or father or mother or sister or cousin or friend. So those aren't just numbers, those are real people. So 51 million uninsured. We spend $2.6 trillion a year annually on health care. The most of any country in the world, yet we don't have the health outcomes to show it. We're 49th in life expectancy of all the countries in the world. So even though we're spending all this money, we don't have the health outcomes to show it. So that's why we thought something had to be done about health care. We thought there was a moral and economic imperative to do something, and that's why the law passed 2 years ago. I'm going to quickly just tell you about a couple of provisions that have already taken place or will take place. You heard about a lot of them already. But first of all, from now on, insurance companies don't get to raise the rates unilaterally the way they did in the past. You heard about companies like Anthem raising their rates 39%. You had no say in that, but now there is. What took effect September of last year, no company gets to raise the rates by more than 10% without getting approval to do so. And you have a right to comment on that. If an insurance company wants to raise their rates more than 10%, they have to make that public, they have to give justification, and you get to comment on it, and then it gets approved or disapproved. Here in Pennsylvania, we already had 2 cases in the last 6 months where we at HHS determined that the rate increases they were asking for were not okay.
So from the time he was 19 years old until he was 24, he went with no insurance. And in 2010, late 2010, he developed a double hernia. And he needed to go to the doctor for that, but he couldn't afford to go for an operation. But it just so happened that in 2010, that's when Mr. Obama passed the Obamacare, and that's when he was able to get on in January. He was able to get on my insurance at work, and he was able to get the operation that he needed without having to go into debt for the rest of his life. I say I'm proud, and don't let these other people who say it derogatorily say it your way. Now, I know that in France, Canada, England, Germany, Hong Kong, and Cuba, they all have universal health care with single payer or some form of it. And they pay less for their health care than we do in this country. They have better results because most of their people are covered. We have politicians in this country that know that our old health care was not working, yet they want us to go back to the failed system.
I guarantee you, everybody here either has a pre-existing condition or knows someone who does. 47% of Americans have a pre-existing condition. And just last year, 615,000 Americans were denied health insurance because of a pre-existing condition. And companies list 425 conditions for why they can deny you insurance. It's not just the big things like cancer or heart disease. It's things like acne. And we know women haven't been able to get insurance because of being pregnant. That's not okay, and that doesn't happen any longer. Come 2014, everybody gets insurance if they have a pre-existing condition. Cheryl, your story is heartbreaking. That is a tragedy. And I know, even though it's been 14 years, you wake up every day heartbroken without your son because someone wouldn't give him insurance. But that doesn't happen anymore.